I'm Carolyn. I'm going to be your student nurse today, and I'm going to be giving you the injections. I'm going to provide privacy for my patients and wash my hands. Could you tell me your name and date of birth, please?
Carolyn Watson, T1492.
Okay. Could you stand up for me? For the subcutaneous injection, I can use the lateral part of the upper arm, the lateral part of the upper thigh, the abdominal area, and you want to stay 2 inches on each side of the umbilicus. I could apply it at the fatty part of the hip and the upper back. And for a subcutaneous injection, I would use a 25 to 27 gauge needle that's 1/2 inch to 5/8 inch long with a 1 to 3 milliliter syringe, and I would insert it at a 45 to 90 degree angle. For IM, I would use a deltoid muscle. I would find the bone, make a V, and insert the needle there. Could you draw that for me? I would find the greater trochanter and go up to the iliac crest, and this will be my ventrogluteal, and this will be my dorsogluteal injection site. And also I would find the midline seam of the leg and the lateral seam of the leg, place my hand below the hip and above the knee, and that would be the vastolateralis injection site. And for our IM injection, I would use a 20 to 23 gauge needle that's 1 inch to 1/2 inch long and a 1 to 3 milliliter syringe. And I would draw up 1 milliliter of air, into my syringe. I would wipe this down with alcohol because the top's already off. I would place the syringe in here and I would inject the air. I would pull back 1 milliliter. And if there's any bubbles or anything, I will push that out. And I'm going to push this right here for a minute until I put on my gloves. And this would be the deltoid where I would inject the IM. And I would wipe that down with alcohol. And for the deltoid, I would make sure the skin's taut and spread it. I would insert the needle with a dart-like motion at 90 degree angle, and I would slowly inject the medicine, pull out and apply pressure, and I would throw the needle away in the sharps container. And then for my subcutaneous, I would again wipe the area down with alcohol, and I would pull back however much I needed. I'm just going to use air for this one. I would pinch the skin for the subcutaneous, and I would insert it at a 90 degree or 45 degree angle, and I would slowly inject the medicine, pull out, apply pressure, and if it starts to bleed or anything, you can always put on a Band-Aid. I would throw the needle away in the sharps container. I would remove my gloves, perform hand hygiene, and document.